A trapped nerve in the neck can cause pain which is severe and or constant, and often it leads to pain which refers out into the arm and sometimes causes pins and needles or numbness in the hand. It's caused due to, most commonly, a bulging disc in the neck, which you can see here on the model of the spine. This is a representation of a disc, and the disc can deform and bulge, and it will put pressure on one of the nerves which lies closest to it. The ideal treatment for this problem is mechanical traction, where the neck is stretched longitudinally upwards, thus relieving pressure on the disc and on the nerve. It's a very hard problem to self-manage, but there are a few things that you should try. For example, if you find that movement of the neck is restricted in one or more directions, you should try to encourage gently that movement repeatedly to reduce stiffness in the joints and surrounding muscle tension. If you are sitting, try to support the arm by using a cushion or using the armrest of a chair, because that takes the weight of the arm and it helps to relieve some of the drag which occurs on the muscles of the shoulder and also the nerve itself. People often comment that if they have difficulty sleeping, that if they lie on their back and place their arm up above their head or behind their head, that can be a position which gives relief. And lastly, stretches are vital to help to reduce muscle tension once again, and also nerve tension. So stick with me now and I will demonstrate some of these stretches and some effective relief and rest positions.
This is neck retraction. The chin is tucked in and the neck is drawn back and held for 3 seconds and then released. Try to get a double chin effect here. So repeat 10 of these. This is the radial nerve stretch. The arm is rotated inwards, the wrist is flexed and the head is tilted away, and the arm is raised, and you hold that position and stretch. This is the opposite stretch. Now the median nerve stretch, the arm is rotated outwards with the wrist extended against a wall. If that position is too hard to get into, then you do the stretch in this position and sitting, where the hand is placed behind you. This is the ulnar nerve stretch. Now bringing the hand up to the face to make a funny face. Or an alternative position is in side lying. Notice the fingers pointing down the side of the face. This is a resting position in sitting. Take load off the shoulder, and this is the resting position in lying. Hand behind the head.
So I've demonstrated techniques for stretching the 3 nerves of the arm: the radial nerve, ulnar nerve and median nerve. It's unlikely that all 3 of those will be symptomatic, so you should choose 1 or 2 which do reproduce your symptoms or which are tight and focus on those. Doing it within the bounds of comfort. Don't push any of these too hard. It's likely that you will feel some degree of discomfort, but the idea is to help reduce tension, reduce ache, and cause you to become more flexible, but not to bring symptoms on to a degree where it's causing you a lot of pain. Thanks for watching, and I hope you found that helpful.